We'll call to order the Interim Joint Committee on Appropriations and Revenue, Wednesday, November the 5th, 2025, 1 p.m. Eastern Time in Annex Room 149. Please call the roll.
Senator Boswell. Senator Funke-Fromeyer.
Present.
Senator Givens. Senator Maiden. Senator Mays-Bledsoe. Senator Neal. Senator Nunn.
Here.
Senator Rawlings.
Here.
Senator Richardson. Here. Senator Webb. Representative Banta.
Present.
Representative Bojanowski. Here. Representative Bowling.
Here.
Representative Bray.
Present.
Representative Bridges. Here. Representative Brown. Representative Dietz. Here. Representative Fleming. Representative Freeland.
Present.
Representative Fugit.
Here.
Representative Gentry.
Here.
Representative Hart. Representative Lockett. Here. Representative McPherson.
Here.
Representative Riley. Here. Representative Stevenson. Representative Thomas.
Present.
Representative Truitt.
Here.
Representative Upchurch. Representative Williams.
Here.
Co-Chair McDaniel. Chair Petrie.
Here. And before we begin, I want to yield over to Representative Bray.
Thank you, Mr. Chairman. In light of the tragic circumstances that happened at the UPS airport yesterday, I thought it would be appropriate to have a moment of silence to start the meeting. I think as of now, they've declared that 9 people have lost their lives, and there's still several people missing. So,
very much so. If everybody in the room will, a moment of silence for all those that have been directly affected and all those indirectly affected, and what it's going to take, the ripple in their families' lives and their friends and family both. Just a moment of silence. Thank you. First up on the agenda for today, we have approval of minutes. We'll entertain a motion for approval of the minutes. Have a motion, have a second. All in favor, aye. All opposed, like sign. Minutes are approved. Substantively, we have the personnel cabinet up on item number 3 regarding a couple of issues: state health insurance plans and the executive branch salary schedule adjustments. I would just say everybody, unless there's a reason to roll people in, just everybody at one time is good. Thank you all for coming in, and if each of you will introduce yourselves for the record, make sure your microphones are sufficiently close to you. The green light at the bottom, at the base, is really green, and if you'll introduce yourselves, please.
Good afternoon. Chris Chamness, Commissioner for the Department of Employee Insurance.
Robert Long, Deputy Secretary.
John Hicks, State Budget Director, Governor's Executive Secretary, Cabinet.
Very good. Thank you again for all of you for coming in. If you will raise your right hands. Do you swear or affirm to tell the truth, the whole truth, and nothing but the truth?
I do.
Thank you very much. And we have first on the agenda the state health insurance plans, and then second we had executive branch salary schedule adjustment. There, you'll probably want to, everyone in the committee will likely look at your committee packet to make sure you follow along. Take those in whichever order is easiest and most efficient for the three of you.
Okay. Well, again, good afternoon. Thanks for inviting us here today. Chair Petrie, you had sent a number of questions over to us, and we have a brief presentation to address those questions, but then, of course, welcome any questions after that. We want to just start by reestablishing the population we're talking about for the health plan. Our members are first and foremost in our minds. As you can see from this pie chart here, we have a membership that represents several different groups. And we're somewhat unusual compared to some state plans in terms of our eligibility under statute. And the ways that we're somewhat unusual is that we do cover pre-65 retirees. We also cover a significant portion of school board employees across the Commonwealth. And then as you see, state agencies actually represent only the third largest group. Then we have quasi-governmental organizations that are allowed in by statute, as well as the judicial and legislative branches. The size of the population and the fact that it makes up various risk and age categories is actually very helpful to us in terms of diversifying out our risk pool. So, for example, while pre-65 retirees tend to be higher cost claimants, that's offset by the relatively lower cost of school board employees who tend to be younger and therefore healthier with less expensive claims.
If you don't mind, I'm sorry.
Sure.
Just on that prior slide, I want to make sure we're all clear. 300,000 people approximately is what's covered. Is that correct?
Across all of our benefit offerings, yes, sir. If we were talking about only active health and pharmacy benefit enrollment, that number is about 265,000 individuals.
Okay, so at most around 300,000, 260 to 300 depending on the category. And school boards, you've focused on over half of that population as school boards. That would be comprised of both classified and non-classified. It's basically anyone that would be employed by a school district.
Yes, sir. Teachers and administrators. Certain school boards, depending on their contract with certain administrators, they may be contracted as independent contractors. Sometimes they may or may not be included in the plan, depending on their employment relationship with the school board. But yes, we're talking about all different levels.
Very good. And has this population stayed relatively consistent, or has it grown a whole lot in a short amount of time, or decreased a whole lot in a short amount of time?
We're relatively thankful to have a fairly stable population. You'll have swings of maybe 2 to 3% year on year, but even pre and then post pandemic, we've had a relatively stable population group.
All right, very good. Thank you. Sorry. Thank you, though.
No, my pleasure. And then kind of setting the table for some of the dynamics in terms of expenses related to the plans, we wanted to hone in on claims specifically for a moment. If you follow the red line on this chart, that's the number of claims. And then the blue bars represent the net pay amounts paid by the plan for a claim specifically. So, again, these aren't all expenses. These are just the pharmacy and medical claims, which represent, the vast majority of claims paid out, vast majority of expenses, I should say, paid out of the plan trust. And obviously we've seen those numbers grow over time. The health plan is not unique in that respect. This is a dynamic that our actuaries and consultants, Aon, assures us is common in the marketplace, as has Anthem of Kentucky reflected to us that this claims experience is in line with what they see for other both private and public sector plans.
And there's no 25 information on that too soon since the close of the year?
Yes, sir. I mean, we can talk about projections to some degree, and there's an Aon slide that has some projections for this year that will be more comprehensive.
All right. Thank you.
Yes, sir. And so we get to premium changes, and these represent, recent premium changes on both in terms of the employee contribution and the employer contribution. And for the most part, we didn't reflect all the years in which there wasn't a premium increase, with the exception of we did want to call out those italicized years there under the employee category, 23 through 2025, as being no increase in employee premiums. As you all may remember, that was part of a concerted effort between the administration and the legislature as part of our overall attempt for recruitment and retention of state employees. You all have been very generous in terms of having employee salary increases. We didn't want that positive work to be undone immediately by increases in employee premiums. And so that has been impactful in terms of those objectives. So now another question was about the 10-year look back in total expenditures, and as you see on this slide, there's very sustained and growth year on year in terms of total expenditures by the plan. That 2024 number, I want to call it specifically, is subject to some change. This was based on a snapshot end of June. Obviously, there's running claims readjudication or other incidents that may affect these numbers slightly. But for the most part, these accurately reflect the current experience of what's paid out of the planned trust. One of your questions, Chair Petrie, was asking about what does it cost the taxpayers, which is a perfectly understandable question. That is a complicated question that is difficult to answer. So because we have more than 600 participating employer entities in the plan, all of whom are submitting total premiums into the plan trust, we have some difficulty being able to answer that question with specificity. Employer financials further complicate this question. So, as you saw on an earlier slide, the state agencies are one sliver of our population, but some employers have federal funding sources, are quasi-governmental entities, so on and so forth, that use those funds from various sources to pay for the employer portion of plan premiums. And then further, Kentucky Employees Health Plan is a self-funded cafeteria plan where we're funded by the plan trust that then is offset by claims. So, every dollar not paid by an employee, is interest earning, but there are other dynamics that go into the total claims expense. One that makes sense to call out here is that you do have drug rebates, right, that do provide a offset on a retroactive basis to prescription drug spends. Those are credited back typically every quarter within a final end of year recredit. So all of those factors, and I could list others, but in the interest of time, I will not complicate the ultimate question, but certainly if you have specific questions, we're happy to address them. And then I wanted to get to a slide that I think may be very helpful to the members here to kind of see what are we looking at going forward in terms of projected expense experience for the plan. So again, the plan is not unique in that there are macroeconomic headwinds that we're experiencing in terms of increased costs. That those are reflected by a few different factors that are listed here on the slide. And in the medical field, a lot of our increased cost we're just seeing by increased utilization. Members are using the benefit more. There are more claims coming into the plan that are ultimately adjudicated as correct claims. That is resulting in drivers of spend on the medical side. On the pharmacy side, it's a bit more complex. We are certainly seeing increases in unit costs. You can think of that kind of like the price of the drug itself charged to the plan, but then also increases in the drug mix, meaning that more members are taking more expensive drugs. There are a lot of new drug advancements that have gone to market, which is certainly good from a member quality of life perspective, but all of those do increase costs to the plan. We are seeing increased utilization here as well on the drug side, and pretty significant increase in utilization. There is some good news out there with the advent of certain biosimilars, including for notably Humira, which used to be a very high-cost drug to the plan. A biosimilar is functionally the same drug on a molecular level, but no longer. I'm about to get out of my wheelhouse, so I'm going to keep this short. But basically, same impact to the member, but not a branded drug, so we were able to purchase that at a much lower cost. That's been helpful, as have the fall in insulin prices. And then we see other discounts. But as you see, overall drug trend has been a significant driver. As we look out projected, we are running a bit ahead of the market, not totally out of line with, but in terms of the pharmaceutical spend, especially this year, What Aon projects is that through the end of 2025, we're running a bit ahead of what you would expect in terms of spend. But then, as you see, we're pretty well in line for 25 into 26 and 26 into 27. And with that, we're happy to take any questions.
Senator Boswell.
Thank you, Mr. Chairman. So it's a proven fact that no matter if it's private or public health plans, that deductibles, in other words, the participation of the employee will reduce the amount of visits that someone might have to a doctor or receive services if they have to participate in the form of deductible. Do the plans for these 300,000 people, do they have any type of a deductible? Is that 100%?
Yes, Senator, appreciate the question. So there are deductibles and maximum out-of-pocket amounts applied each to each of the plan options available. I will say that through changes in federal legislation, a lot of the preventative health visits, like your annual physical, do not have any cost share applied to the member. There's no deductible applied. But yes, sir, there are deductibles for each plan option, and we did make minor increases in those deductibles and maximum out-of-pocket amounts for 2026, in part reflective of this claims experience that we've seen over many years.
Thank you, sir.
Representative Bojanowski.
Yes, thank you. So my question, and what has caused a crisis in the teacher chat world, is the GLP-1s. And so I was just wondering what an impact the GLP-1 prescription costs have had on the state plans. And I mean, it's definitely shifting because the prescription that was $25 is now going to be upward of $250 a month. So it is shifting, although our premiums aren't going up, there are some shifts to employees.
Yes, and we recognize that, and that there is some pain potentially associated with that. We will note that shift that you mentioned is certainly most noticeable on the PPO plan, which used to be a copay, and now under the new GLP-1 weight loss tier would be a deductible. If you get a GLP-1 for diabetes, for example, that remains the same. There's no cost increase there, but for weight loss indications, that is true. That change was in part, it was a recommendation by Aon to us, and part of that is that we actually had lower copay assistance card utilization on those GLP-1 drugs compared to some peer plans. And so this is a change that actually is also being made by our neighbors down in Tennessee, we understand, from Aon. As part of efforts, what we're trying to do is we're trying to make sure that members maximize those copay cards. When they do that, that $250 expense that you mentioned, Representative Bojanowski, would actually be offset by the card in the first several months until the member is getting closer to meeting that deductible.
Representative Lockett.
Thank you, Mr. Chair. I just had a question about, you made a statement about that there's an overall increase in claims. Can you go into a little more detail in terms of what type of claims those are? And is that indicative of, are we, either as state government or as state workers, are we becoming more unhealthy as time goes by? Kind of what do you see is happening there?
And while you're answering that, if they can put the slide back up, I think it was number 3 on claims, payments, numbers, that might be assistive. Yep, thank you.
Yeah, you bet. That's a great question. And the answer is, it depends. I'll try to explain why. So we are seeing an increase in high-cost claimants on the upper end of the spectrum. And those are members who are very, very sick. And because, there are advanced therapies in the marketplace as well as just higher inpatient hospital costs, you are seeing increased costs on the upper margins of our plan population for those high-cost claimants. So, for example, we have some claimants that through 3 quarters have already incurred almost or more than $2 million in medical spend for that one individual, medical and pharmacy spend combined, for that one individual. And that's the allowed amount. That is a reduction in what we would have otherwise paid, if there weren't negotiated rates. So you are seeing that dynamic, especially with high cost claimants, which reflect as much as 40% of our total spend is captured with those individuals that have claims above $100,000. But you also are seeing just greater utilization across the board, and it's not always that members are getting sicker. It's just that they're using benefits more. One example of that is what we see in behavioral health spend is we've seen market increases every year for the past 4 years. And while that certainly incurs more cost, the hope there is that you're actually preventing more serious issues down the line, right? Whether that's substance use disorder, God forbid, some sort of serious attempt to harm oneself. You're avoiding that because people are getting the help they need on the front end. So you would hope that increased spend pays dividends in the long run. Those are two different examples of the dynamics we're seeing.
Thank you.
Thank you. Senator Funky Fromeyer.
Yes, thank you, Chairman. Do you have any ability from east, west, north to south to understand what the validation of costs? Are we seeing consistency amongst providers, or how do we really know? Because you acknowledged what's authorized, but how can we justify whether we're actually paying the appropriate price for health care?
Yeah, I appreciate that question, Senator, because I actually realized I had skipped a talking point that answers that exact question. So, what we've implemented over time is actually a multi-tiered claims integrity approach. So long ago, when we first engaged with Anthem on the medical side, we also contracted with their payment integrity process that basically went through and on the back end confirmed accuracy of those claims as applied to the plan, and confirming that they were not only applied correctly, but there weren't overpayments by the plan, back to providers. So we had to check that way. And then subsequent to that, the legislature passed a couple years ago with respect to the pharmacy benefit, and then the year thereafter with the medical benefit, also an outside payment and claims integrity vendor. So right now we have two vendors, Health Plan Data Solutions on the pharmacy side and 4C Health on the medical side, and they then take a further look as an outside player to confirm claims accuracy, and where they have found errors, those errors are then re-adjudicated and the plan takes savings. Under both of those contracts, we don't pay anything to those outside vendors until those savings have been realized back into the plan, and then we pay about a 30% bounty back to the outside vendor. So in both cases, we have a level of confidence that with that multi-tiered approach, we're paying accurately.
Representative Bray.
Thank you, Mr. Chairman. If you don't care, could you go to the next slide? All right. So I want to focus on the employer increases, because when I look going back to 2015, we've got 1.5%, 2%, 1%, 3%, 3%. And then in 2023, we jump up a staggering 10% and then go even further than that to 16.5% in 2024. One, can you speak to that? What's caused that to happen? And then secondly, what are your all's projections going forward? Because this looks like it's not a linear increase.
Yeah, I appreciate that question, and you're right. I mean, in recent history, the increases are not linear, and they are a direct result of the claims experience we're seeing. So those premium recommendations, and I should point out here, these are calendar years, right? So they don't align with fiscal years, but these calendar year changes reflect the increased costs that the plan is seeing directly. And what the way the process works is that Aon, as our actuaries and consultants, do a robust analysis where they look at our claims experience, both in the recent past and then further back. And then they're also doing a marketplace analysis to try to project forward what the costs will be to the plan. And the dynamics that you're seeing in terms of the increases do really harken back to the claims experience we're seeing here on this slide. And then part of those recommendations then go to the Office of State Budget Director. And as you all may know, there's a collaborative process as part of the budget process between OSBD and the legislature to then set those employer increases as part of the budget process for the next budget biennium. And beyond that, I'm again outside of my wheelhouse, so I defer to the man 2 seats to my right.
Yeah, Representative Bray, I would ask that we take the input from the Aon forecast and our actual experience, and we look at, in essence, what is the expected cost, right? That's what Chris was describing, and then in the budget process, you take a look on, what do you do to modify some of those costs. He talked about some slight changes to maximum amount of pocket and deductibles as an example, right? Where as Representative Bojanowski just said, that's a little additional hit onto the employee in the family, and so then it's a question of balance between the employer and the employee premium increase, right? So that's the major revenue streams that come in, and so as Chris mentioned earlier, it was a very given the total expense, right, it was a very conscious decision in the last several years to, enhance the pay increase that we provided for state employees and others by not increasing the employee premium. So we had several years of no increases in employee premiums, a very conscious policy decision embedded into the budget process. And so some of those numbers you saw that are double digits there on the employer side were so that there weren't increases on the employee side. But the totality of what we're expected to spend, though, is really based upon the actuarial analysis with some tweaks sometimes to benefit changes, which, like I said, the maximum amount of pocket or deductibles. And in some years back, it's been a while, we totally changed, the consumer-directed health plans became a provision that we've incorporated into our health insurance plans for employees, both to mitigate the cost to taxpayers, but also to incentivize healthy behavior on the part of those who are benefiting. So those combination of things really kind of lead to how do we split the cost?
Sticking on slide 4 for a moment. Looking at 23 in particular, we've got a jump from a combined 6 to a 10% on the employer only, and in 24, a 0% that goes up to a 16.5%. And 25 on the employee, we're showing 0. 25, I don't have a number for, 1%. Correct?
Well, on the employee side, on the employer side, sorry, that was 0 as well.
Employer side was 0?
Yes,
or
sir.
Employee?
Both.
Okay.
Both.
All right. And as far as what we've got projected coming up over the next 2 years, I know the ABRs are out, so what are we looking at for the next 2 years?
For the agency budget request process, after working with our employee health plan and Aon, we have a 10% per year employer increase and a 3% increase in employee premiums. That was the assumptions that were incorporated into the budget requests.
Very good. And is that with a change in coverage or a change in scope, or is this just a change on the numbers?
In that case, it was a change in the numbers based upon Aon's, estimate of expenses.
So no scope changes.
Correct.
No coverage change.
That's right.
Just an adjustment on the who's paying how much.
Correct.
Okay. Any other adjustments coming up?
Chris had mentioned for the calendar 26, we do some adjustments there to out-of-pocket and maximum out-of-pocket and the deductibles. And then as we move into the budget process, we're going to take a look and consider, what else, that we might take a look at.
Very good. Any other question or comment? Thank you all very much. And I don't know how many of you need to stick around for the next little bitty piece under this, which is executive branch salary schedule adjustments. And that really deals with a memo personnel cabinet back on August the 15th of 2025, which is in the packets. And really, and Secretary Hicks, I'm going to assume, correct me if I'm wrong. I'm going to assume you're probably going to take lead on this one.
We're going to let Robert Long take the
Oh,
lead
great!
on that
We'll
one.
do that. Even better. We've got.
But I've got great support in case I need it.
Very good. So all it is. First big question is this. So what does this mean? Help us understand what's the thought process behind doing it.
All right. Well, so for the last, I think, 4 years or so, the legislature has been gracious enough to grant an annual increment. Along with each annual increment across the board to state employees, there has been also then an executive order entered allowing an authorization to adjust the salary schedule, being the minimum starting point and the midpoint, to match that annual increment. So it's basically just keeping our salary schedule in line with what has been budgeted and what has been approved going forward. So it's just a match. So this calendar year, the employees received a 3% annual increment. We then adjusted those salary schedules by 3% per executive order effective September 16th.
And I'll add, Representative Petrie, that as we've talked about, for the last several years, the compensation package for state employees and others, one of the things that we mentioned, and Secretary Bailey is continuing to talk about, is as we raise the salary increments of people or raise other pays, we raise the salary schedule in equivalent. And that way it keeps us from the years in which we had no pay increases and had some pay increases. And so it helps prevent future compression of salaries among less senior employees to more senior employees. And so that's been part of the Secretary's kind of plan to try to maintain, not to get ahead of that issue, as we move forward in time. And so as Robert said, every year that you all did a salary increase, we increased the salary schedule by that same percentage increase. It's a costless change to the salary schedule because we've already bumped up the salaries of the employees.
It's going to be the next. There should not be any cost to this.
That's correct.
Okay.
Yes.
Secretary Hicks, we had discussed somewhere mid-late February of 25 a potential addressment of the compression issue on state salaries. Would this move, what impact would this have on that discussion? Would it significantly change it or partially change it or not at all?
I'd say it keeps it from getting worse. So really no change, in that sense. It doesn't improve it, but it prevents it from getting worse.
Gotcha. And then while I'm on that topic, if I recall correctly, I believe budget language may have had an RFP to go out to deal with the compression issue at some point. I believe there may have been an attempted 1 or 2 RFPs that went out on that issue. Both of those were unsuccessful. Is that correct?
Yes, sir, that's correct.
Yeah, and what was the reason that those failed?
I would probably have to go back and ask, but my understanding is that in both instances there was not a qualified bidder identified.
I believe it was the same bidder each time. Does that sound right?
I believe there was only one each time, and in each time they could not meet the requirements of the RFP.
Okay. All right. Any comments? I'm sorry. Senator Boswell, thank you.
Thank you, Mr. Chairman. Well, number one email I'm getting right now is about salary compressions. And it's, I guess this is a rhetorical question. You might not have the answer. But it's beyond my belief that we could be hiring new employees at the same level that people have been working 10 or 15 years. It's beyond my belief that we could do that we could ever have a point in our time. I'm an employer. I can't believe that I would ever hire somebody and bring them in at the same level as someone that's been maybe less in some cases. And so this is a serious problem. We need to deal with it.
And I'm going to echo that it's a serious problem that has been dealt with in spurts and sputters for a few years. But I will say this, it is one of the more difficult pieces I have come across in state government as far as you cannot simplify it, you cannot boil it down, and you cannot only find 3 angles on it. It is truly a balloon that you push, tie, tape, move, stretch, and you just try to keep it together and make it be the best that it can. And it is difficult, I will give you that. But we do have to continue work on it. I get these questions on compression. We've talked about it since, June or July of 21 with former Secretary Weathers, I think. All kinds of studies and studies not and studies too. Hopefully we'll make even further progress. Very good. Anybody else comment or question? Thank y'all very much.
Thank you.
Next up on the agenda, we have nutrition program for the elderly, and I believe we have a longtime listener, first time participant, I believe. If each of you will introduce yourselves to the record, please. Make sure the microphones are on. The green light on the base is really green.
I'm Stephen Stack, Secretary of the Cabinet for Health and Family Services.
John Hicks, State Budget Director.
Very good. And Secretary Hicks, you remain under oath. Secretary Stack, if you will, raise your right hand. Do you swear or affirm to tell the truth, whole truth, nothing but the truth?
I do.
Thank you very much. And what we have on is a topic of recent notoriety about senior meals. So most people will be somewhat familiar with that, whether accurately or inaccurately. But if you will, help us through your presentation on the issue itself.
Sure. Thank you, Mr. Chair. So good afternoon, everyone. We'll talk about the senior meal program here in Kentucky. So this is a federal, state, and local government partnership. I'm not going to dwell on this slide, except there's a federal statute, the Older Americans Act, that provides a structure and support for this. At the state level, we rely on the Older Americans Act, and we also expand it. I'll clarify that with an example here, but expand the program slightly at the state level through regulation. And then regionally, the area development districts are our partners who help to fulfill the program, who actually close that last mile and reach the citizens in need of assistance. So the senior meal program has eligibility rules. These are relatively stable. They have not changed recently. For people who come into a senior living community or a senior center, they have congregate meals. They can eat together there where meals are served. You have to be 60 or older, and their spouse of any age is welcome to join them there. There's no other requirements other than you have to be 60 or older, and then you can have a +1 as a spouse. For home-delivered meals, there's additional requirements. You have to be homebound, meaning you have difficulties leaving your house, and you have to require activities of daily living assistance, so you need help with various daily needs. And there has to be other criteria, like no one's there able to prepare nutritious meals for you, and you're not able to drive yourself to a senior center.
For the sake of clarity on that prior slide.
Sure.
There is no means test to the Senior Citizen Center congregate portion.
Correct. It is purely an age threshold.
If you are 60 or above, then you're going to qualify if you show up and you can bring someone with you.
Correct.
Is there any other qualifier to it than that? That's
No.
it.
Nope.
Okay, only on the home delivered are there additional requirements, is that correct?
On this one here, I don't think there's an income requirement.
Not an income, but there are
it's age or disability related, yes.
So there's a disability issue, well, not a legal disability, but there are additional requirements around it.
Correct.
Okay.
And then what I was going to show on, did you have another question? Sure.
No.
So on the next slide, I was just going to show, this is the statutory reference from federal statute, which just replicates what I showed on the previous slide. And then here's an excerpt from our state regulation. And what we essentially did here is we just took, on the federal law, it says you may also be able to get services if you have a disability. We just incorporated that all into the state program here, both the age and the disability aspects.
So is that second part optional at a state level?
It's required at the state level in this reg. It's optional at the federal level for the disability part.
Okay, thank you.
You're welcome. So then now here's where the data comes in. So the number of meals provided has increased over time, but if you look pre-pandemic from 2015 to 2019, it was relatively stable. It was at about 1.9 million meals per year that were served. Then the pandemic occurred. Obviously, people were homebound, unable to get out for different reasons, and things changed. And then you had a surge in 2021 where we went up to 3.2 million meals in that year, and that was the high water mark. There was a slight decrease there in 2022, but then it returned pretty quickly back up to that roughly that prior peak. So in FY25, the year we just concluded, we served 3.1 million about 3.1 million meals, which was a significant increase over about the 1.9 million that we had as a stable benchmark before the the pandemic. And that line that we've mapped just helps to make more clear that trend line. The meals are provided those two different ways: congregate, meaning you go to a senior center or somewhere like that to have the meal, or they're delivered to you. It's about 75% delivered and 25% congregate, and that's relatively stable ratio over time. It varies obviously a little bit from year to year. Now here's where we ended up with this year's situation. The funding changed during COVID. So the green bars on the left are state general funds, and I wrote this down in the when you actually navigate the slide deck, you can see the numbers. But that was about $1.6, $1.5 million in 2019 and 2020 was state funds. And then the blue bar is the federal grant we receive that provides for the ability to provide these meals. That was $8 million in 2019 and about $10 million in 2020, just to kind of get a baseline. It's gone up a little bit, and if you go to the far right, it's about just under $13 million in 26, but it's not a big increase. It's a relatively modest increase. The blue bar, again, is the federal dollars from the grant. The yellow bar, this is all now an artifact of COVID. You see in 2021, remember these are state fiscal years labeled there. The pandemic began a few months before the beginning of state fiscal year 21, and that's when we started having this influx of extra federal money to support a wide array of different programs. And so you see that yellow bar grew substantially. So it went to $5 million the first year we had it there in 21, but it went all the way up in 24 to a little over $20 million in federal support.
Yeah, and let me add something in those. There were kind of two buckets of additional funds. There was additional money to the existing program, the federal program, the congregate and home delivered. And then in the state fiscal recovery fund, the $2.1 billion that we've got, you all had identified, I think it was about $32 million over multiple years to the senior meal program to try to prevent, waiting list and address, the fact that COVID happened and we had people who were unable to get out. So that was, a combination of the additional funds out of the ARPA fund, the ARPA Act.
And then when you go to 25, and now you see we put a fourth color there, the purple bar. This gets a little harder for me to explain, but it's the COVID money, because we had employees working on various other projects or on other tasks. They were coded to COVID dollars. There was money that was liberated or freed, either because we were using staff for other purposes, or we had vacancy credits where unfilled positions, or in one instance we had restricted funds. We had audit recovery funds where we recovered funds after audits. And because the money was not needed at that moment for another program, it was deployed in this program. And so the purple bar there represents another $5.9 million of other state funds, different than what we would call state general funds. The green bar on the left is when the legislature and the governor both put in for $10 million extra to fund the senior meal program in state fiscal year 25 and 26. So you see the green bar is slightly over $10 million. There must have been some other very modest amount of general funds that we had that we applied to this area. So those totals there totaled up to just shy of, I think, $33 million in state fiscal year 25. When we got to 26, there was no more federal supplemental dollars. The yellow bar completely disappears. And now there are not vacancy credits. We've been able to successfully fill our positions. We also didn't have that one-time bump that we'd had from the audit recovery funds. And in addition, some of the other programs had uptake and participation, and so they fully consumed their apportionment for financing.
Yeah, and I will add on that purple bar, there was about $2.5 million from other aging programs through the area development districts that later in the year, they monitor it every month. What do you need? Do you still need everything we've allocated? They were able to, in essence, turn back in some of those allocations particularly for the home care program near the year end. We were able to then deploy those to the senior meal program.
And so some of that carryover then offset that, and then you lead to fiscal year 26, and this was the situation where we found ourselves in a shortfall. I'll note that the program has, as I showed on this previous slide, continued to grow on the right side of the curve, from the slight decrease in 22. So the program continued to grow. The costs continued to escalate. So the per meal cost is now, I think, a little more than double what it was if you go back to 2020. So that in about 5-6 years, the cost per meal has doubled, and we all know about inflation and what people are seeing at the grocery store. That impacts this as well. Some area development districts did some other innovative things to try to deliver meals using trucks and drive the meals to people who are unable to pick them up themselves. So there's variation across the area development districts in their cost per meal to produce this service. But the end result was the program continued to grow. There was the loss of one-time federal funds. There was the non-recurrence of one-time state funds, and we found ourselves in a shortfall. And that pretty much catches you up to the events that led to the apportionment of another $9.1 million this year to sustain the senior meal program at levels consistent with state fiscal year 25. One other thing that I'm going to offer here is that the area development districts, when we communicated with them, we were going to hold them harmless. Essentially what they got for 25, when we got the 9.1 million, we were going to give them the same amount they had in 25. They asked us to do it differently than that. They had their own forecasting for what their shortfalls would be across the 15 area development districts. They asked us to apportion the money a different way. All 15 ad directors signed on to an agreement that that was in fact what they requested, and we deferred to the local agencies in that regard and have given them their new apportionments based on the model that they have given us. So I think that brings us to the end of our remarks, and we're available for questions.
Thank you very much. Representative Thomas.
Yeah, thank y'all for your report. I know it's hard to see which person's talking there. Right after that hit and that the senior meals were going to be cut, it hit my community pretty heavy too there. But I went out on one of the routes and it lasted about 4 hours. And so I highly recommend any committee members, if you get a chance, go out there. What I noticed is there was some, I went on a Friday, there was some that you would not, no one's going to see or check on that person until Monday when the meal comes again. And some of these individuals really need it. There's probably some that didn't, but out of the 30 or 40 deliveries that we did, everyone I saw really could use it. And some of them were in pretty rough shape too. So I highly recommend, if you get a chance, I know this is a big topic right now. If you get a couple hours, ride with your program and see what some of this program's about, because a lot of it's good. Does it need tweaking? I think it does, but we'll go from there. Thanks.
Very good. Thank you. Just a couple, 3 follow-ups, I hope. On slide, senior meal funding source would be the easiest way to get back to that. Thank you very much. So my questions or comments are not really about the details of the program, but how did we get there? And this is not a finger-pointing exercise. But how did we get there so we can avoid it? And I say we, y'all and us. How can we avoid it? Is it avoidable? So when I look at the gold yellow bars, non-recurring federal funds, we all know in advance that those were not going to continue. That was set, and then the balls begin to roll, and we all know where they're going to end and when they're going to end. Okay, so that's a known entity. The green funding, state general fund, we all knew what that was. We had some issues with projections back in the 24 session. I think the ads had asked for maybe a combined $9 million more than what the agency had requested, and I know there was a back and forth over that. So there's projections are difficult. I'm not sure how that happened, but their projections were pretty accurate. State government was not. There was a shortfall in FY25, correct? FY25 was where we had the issue of a shortfall. There were funds that were repurposed from other areas in order to shore up the I don't know how much it was, how much it was short in FY25, and I've twice heard, once Commissioner Eldridge and Legislative Oversight and Investigative Committee under oath, and you today. Vacancy credits were some of the ways that there was a liquidation of vacancy credits in order to shore up the shortfall for FY25.
Yeah.
So, one, how much vacancy credit was utilized? Was it liquidated and poured in to shore up the shortfall?
It was about a little over 1.1 million.
1.1 million?
Yeah. The biggest piece of that purple bar were other general funded aging programs that were already appropriated to the Aging and Independent Living Appropriation Unit that the area development districts later in the year said don't need them here. And so the cabinet and the department said, but we need them here in the senior meals program. So that was actually the biggest piece of within the appropriation unit of general fund.
Yeah, and so the total shortfall in FY25 would have been approximately how much?
Well, from the state funds that were redeployed that we just described is about 5.7 million. The rest of it is in the yellow bar, which is there were a little bit of leftover COVID funds.
So we had about 5.7 repurposed, and we had about 1.1 liquidated vacancy credits.
That's the 1.1's inside the 5.7.
Okay. And do you know when those allotment changes or liquidation changes took place in FY25?
I would say the latter half, if not the last quarter.
Okay. So at least by May, I would say May, this was a known shortage, and how do we deal with it, and found the money in order to deal with it in FY25.
Yes.
Okay. I'm going to assume that there will be an anticipated shortage in FY26. That would have to be what your projections are showing. Correct, incorrect?
Can I, Chair? There's two ways to look. Well, there's probably numerous ways to look at this, but let me, from a programmatic way, look at it. Because I get the concept of the problem, and we had a previous discussion, and I share the concern about when the tide goes out on one-time federal funding, what's left.
Right.
One of the challenges is when there's money and it's available for allowable purposes, there's the programmatic desire to support Kentuckians who are in need. So this was one of those allowable ways. This program continued, we showed that growth of over 1 million meals over just 5 or 6 years. I think had we not had that one-time federal funds, this program would have probably never grown this size, which I think is part of the point you're trying to make. The alternative would have been to simply just not provide the support.
Yeah.
So I think when the team, remember I only became secretary later in this journey this summer, so I think that they felt they had the money and the opportunity, so they allowed the program to grow and meet the need that was perceived to be there. Yeah. So I think what ended up happening is probably when they made those original projections, the program consumed even more, because actually it's beyond. If we had that whole that extra little under $5 million that spread between the 14.6 and the 10 million that's come up, we still would have been probably $5 million short, because we had to infuse 9.1 million to keep the program where it was. So the program grew beyond what even anyone had forecast for. So, which you've acknowledged the difficulty with the forecasting. So, So go ahead.
And I would add that as COVID hit and we were looking at ways we'd spend that $2.1 billion in state fiscal recovery fund, to us, in talking with the cabinet at the time, it was a waiting list, right? The senior meals program prior to COVID was never fully funded, because we basically had the federal grant and a little bit of general fund, and that was it. And it served whomever it could afford to serve. And so as the governor and then as you all kind of were deploying that state fiscal recovery fund, let's get rid of the waiting list was a very supportive, agreed upon policy approach. And so we now have a shortfall, but in the past we called it a waiting list. They were the same thing, which is I only had this much money, but I had this much demand. And so now, we were able to thankfully satisfy a higher level of demand. And then as we get into as we were doing in 24, right, we'd estimated 10 million, the as estimated 14.5 million. We were both wrong. It was 19 million. And so, but a little bit of history is in the past, we didn't, that's how we approached it. It was almost a 100% federally funded program, right? Yeah. And the state put in a little bit. And so we've kind of, as in the 24 session, chose to have the general fund supplement the federal grant.
Understood. What I'm getting at is the timing of, we know there's a shortfall in the FY25 at least by May of 25. Oh, yeah. Okay, and so you figure out a way to do that. This doesn't come out in alarm bells by memo or anything else until September of 25. Ad districts, in fact, were told in August, keep going, we're fine. Keep pushing the money out, keep pushing the programs out, fine. And then, as we know, there was a memo that turned around in September that said, hold up, we've got a shortfall, and it was, I think, Loic went over this. It was inaccurately said that we had a change in state funding and a change in this. That's not the case. We projected, we all knew what was going on with that, and you knew there was a shortfall in FY25. Know it at least as May, and no one's contacted me, no one's contacted anybody else that I've been able to find, and the ad districts are told to keep going straight ahead and go better, go further. We get an abrupt change in September. That appears entirely avoidable. If you know you already have a shortfall at least by May of 25 and you have to pull funds and liquidate vacancy credits, you know you've got a shortage. You know, even if projections are inaccurate, chances are FY26 is probably going to follow closely to 25, if not more. But at least as much as. So we knew we had a shortage in FY26 coming up, at least by May of 25. But yet we go May, June, July, August. August we're told to go forward and keep going. September, abrupt change. Hold up, we've got a shortage. That causes a lot of problem. It causes a lot of stomach acid. It causes a lot of consternation for no reason, and it appears avoidable. That's my point.
And I hear that. I think the part that I would, again, I'm both saying this, but I'm not trying to hide behind it, but it's part of a reality. The world that I think when this was, again, you're not talking about the projection, you're talking about how it was managed this summer. I get that. But when this was forecast, the world was very different. There was a presidential election, there's HR 1 that's happened, and now there's, and I don't intend to open a new can of worms here on this, but with the revision of the state general fund projection, and we've had to reduce budgets in the current year in order to help address that, all of those things changed the landscape a lot, and a number of those things were not certain in the summer. So I
want to cut. I understand and I appreciate the explanation, but CFG wasn't even dealt with until October. I'm talking about a memo that went out in September and an issue that was known in May. Senator McDaniel.
Thank you, Mr. Chairman. Dr. Stack, good to see you again.
You too.
I would be curious to know, in each of these fiscal years, what kind of, because we pay the ads to execute this program, and I'm assuming they get an administrative fee affiliated with the administration of the program. Is that correct?
They get an apportionment, and there's a portion they're allowed to use for administration, yes.
I would be interested to know what each of the ads was using for administration of the program, broken down by ad, please, in each of these years.
And I know you're co-chair, but that will be a request of this committee today to get that in 14 days would be good, if doable in 14 days.
I think we go to the ads and we have some of that and we go to the ads for the rest. But yes, I don't see why we can't.
If 14 days is not possible, alert staff and give us the next date by which you think it could be.
And then Senator McDaniel, the governor has asked the finance cabinet to do an audit of the program to look at the variation across the ad districts. I think with the intent just to help strengthen the program and help determine what would be reasonable structural changes to be able to support what the ads need, but then also to be accountable for the kind of the consistency across the execution for the program. So that has been requested, and finance cabinet has begun its work in that regard.
Right, and this speaks to the danger anytime we deal with one-time federal funds. I can remember this from the preschool conversations with the previous governor, Bashir, and the removal of the federal supports under under the Obama administration for that, and then the expiration of these now, and the question becomes, people just on the front line of this just simply learn to expect a service, not worry about where the funding source comes from. And, any item that has a state general fund growth of 1,000% in 2 years is not insignificant, right? So we'll probably have more looks and more conversations about this as time advances. But thank you, guys.
Thanks.
And I'm glad to hear about the finance cabinet and actions taken to study the program. That's why I asked a couple of questions about federally anybody over 60, and we have to match that. We're required to do that. But then when you get to the second section of that, that's not the same requirement at the federal level, and we do that on our own.
Correct. They say we may. They don't say we must.
Yes, there's an administrative reg that says we're going to do it that way.
Correct.
Yeah. So that's the program itself, and I think we'll be looking at it. Senator Funky Fromeyer?
So, thank you, Chairman. We did have some discussion about this in our MAHA task force in the month of October, where there are some faith-based, but there are some other institutional, like Appalachian Regional Hospital, indicated they're producing some senior meals as they are wrapping up their cafeteria for the day, and then they're able to do certain donations. So I'm thinking, as we continue to innovate as a state, to work and collaborate. But on that particular note, as we look at if you're offering the in-person meal versus the home delivery meal, I'm not sure, did we see a substantial difference? Is the home delivery meal rising so rapidly and the in-person meal is declining so rapidly? Is there an inverse? And maybe that was.
So is the change I don't think proportionately the utilization has shifted that much for in-person versus home delivered. I don't have the numbers there. On the spreadsheet you can skim them, but visually it looks like it's roughly comparable over time.
Very good. And I want to clean back up on two issues that have, well, one issue that's popped up, vacancy credits. I've got 1.1 here, and Secretary Hicks, I'm just going to ask for the FY25 in particular, if you could get to this committee within that same 14 days, any other vacancy credits across the executive branch that were liquidated, when they were liquidated, how much and what were they applied toward. This may be the only one. That's great. If it's not, then we need a comprehensive list. And if you can't do it in 14 days, then let me know and we'll work out as fast as we can. Secondly, Secretary Stack, you had mentioned, I think I heard, going into reduction planning from CFG and reduction. I understand that each cabinet is supposed to be coming up as of early October, coming up with a plan for those reductions and how to address them on their own. Have you submitted that to the executive branch?
Yeah, that's all processed through OSPD.
So you have. Secretary Hicks, have all the cabinets done that?
Yes, we have draft plans from
they've all complied?
Yes, they have. All the cabinets have, yes.
Okay, can you get those same plans from each of the cabinets to us within 14 days also?
No, sir.
Okay, why not?
Those are preliminary draft plans that we're going to take into consideration before the governor makes his recommendation. And when the governor makes his recommendation, I'll be happy to provide those details to you.
Yeah, so why can we not have a copy of a reduction plan that a cabinet secretary has submitted?
Because it's an input to a decision that the governor makes. It's not a decision that the cabinet makes.
Fine. I'm not looking for the governor's insight. I'm looking for the cabinet's insight and looking for their input. So, no?
The answer is no.
You understand what was that word that was used in the prior presentation? What was that? Do you remember it? Collaboration. This has been going on since 21, where we try to collaborate. Nope, wait for the budget address. Nope, wait. Nope, wait. This is not politics. This is policy. This is budget. This affects Kentuckians. It's not a presidential race. It's not any other race. It affects Kentuckians. I find it atrocious, abhorrent, that the executive branch can't share information about potential plans on how to deal with budgets that affect Kentuckians in unbelievable ways. Wait for the budget address. Wait for it. How about collaboration? Put us under an NDA, put us under a whatever you need, collaboration. We've had bombs laid in budget process that we've picked up on. We've had other issues. Look, we're going to put a budget out. You can do it collaboratively or you can do it adversarially. And the second one is horrible for Kentuckians. I would really hope that you could share. And if it needed to be held confidential so we could just explore the issue without the public and the politics and the press and the Twitters and everything else getting involved, fine. But collaborate. Thank you very much. Next up on the agenda, we have update on DORIS. We have Beth Hertwick, Executive Advisor. Come in, if you will. Make sure the microphone's sufficiently close to you. Make sure the green light's really green. If you introduce yourself for the record, please.
Good afternoon. My name is Beth Hertwick. I'm an executive advisor in the Commissioner's Office for the Department of Revenue, and I also serve as the Chief Product Owner for our DORIS My Taxes implementation.
Very good. If you will, raise your right hand. Do you swear or affirm to tell the truth, whole truth, and nothing but the truth?
I do.
Please proceed.
Good afternoon. I'm here today as the Chief Product Owner for the Department of Revenue's integrated tax system known as DORIS. We had received some questions from Representative Petrie, and I've prepared some testimony to respond to those. So I'll go through my notes and then welcome any questions at the end of my testimony. The DORIS project, once fully implemented, will replace more than 100 legacy applications at the department. Some of those are over 40 years old. We will be introducing a single modern platform that manages all core tax administration functions, including registration, return filing, payment processing, refund issuance, correspondence, integrated audit and compliance features, and real-time taxpayer access through our new My Taxes portal. My Taxes gives citizens 24/7 access to their business data, return filing, also gives them the functionality to file their returns, make their payments, view correspondence that we have sent to the taxpayer, submit account updates, and manage relationships securely. Release 1 went live on March 14th of this year and included functionality for registration, filing, and payment for the following tax types: corporate income and limited liability entity tax, non-resident withholding and employers withholding tax, sales and use and consumers use tax, transient room fee, tire fee, telecommunications tax, commercial mobile radio service, and utilities gross receipts license tax, as well as all revenue accounting functions and registration functions for tobacco tax licensing. And all of that was included in Release 1. Our current status of the system, Release 1 has maintained strong uptime and steady performance since go live. And our taxpayer experience, My Taxes usage continues to grow. Every month when I look at those numbers, we're increasing usage between 5 to 10%. So taxpayers are adopting quickly to the new technology, and we receive positive comments about the expanded features they have available to them. Our customer contact center that we built right before go live was staffed with 50 agents who answer a dedicated phone line and email address simply for the My Taxes platform. They are available 6 a.m. to 6 p.m. to assist taxpayers. At Go Live, we worked 2 weekends of 6 a.m. to 6 p.m. coverage to ensure that our taxpayers had sufficient help as we rolled out the new system. Staff can now view all of the Release 1 taxes in a single system. This increases taxpayer satisfaction because our agents are not having to switch between multiple antiquated systems, and they have a clear view of a taxpayer in one place. So they're able to more quickly resolve issues when taxpayers call us. The system complies with all IRS Publication 1075 and Commonwealth Security standards. The access is role-based, based on lease privilege. It is monitored and audited regularly. We have a dedicated Train the Trainer and training program for our internal staff. We are constantly doing ad hoc trainings at request of the department. We have a way for them to request whatever trainings they need. We build those out, bring them into our new training facility inside the DOR building, and upskill them as needed. As anytime you roll out a system, there are a few hiccups, and I don't want to skip over those. So to address a few of those, change management was a big thing for us. When you're dealing with 1,000-ish employees in a department, you're rolling out a new system, and then you're also dealing with 500 plus business taxpayers. Making sure that you're communicating often and frequently about the upcoming changes to prepare them was incredibly important. Staffing and continuity throughout the life of the project. We started requirements gathering in December of 2019. Obviously, we had retirements, we had resignations, we had lots of turnover during that time. And so making sure that we were preparing backups for everybody, not just one person knows everything. That was very important to us as we continued the project. Technical challenges, which were probably the biggest thing right at our go live time. I think everybody possibly underestimated the number of taxpayers who was going to be ready to log onto the system on day one. A few of us slept on the floor of the conference room when we went live, and at 4:30 a.m. we were hitting the refresh button, and taxpayers were logging in. So they were as excited as we were. I look at that as a good thing. So we did experience some unexpected and unwanted downtime in those first couple of weeks. We quickly worked with our vendor partners to spin up extra server space, to increase whatever needed to be increased as far as bandwidth, to make sure that those did not continue. And in the last 4 months, we've had 2 days with unexpected downtime. So the system is very secure, very stable. We had identified an issue with ACH refunds when we initially started processing refunds. So we turned those off, quickly pivoted to paper checks, and within 30 days had a solution implemented, and were again able to issue those electronic refunds to taxpayers. And then taxpayer messaging. We received some feedback early on that some of the instructions on the portal were a little unclear or a little confusing. So again, we worked very quickly with our vendor partner to update those based on the taxpayer feedback so that there were fewer questions. You don't have to call us because we've provided good on-screen help for you as you enter your tax returns. And then throughout the life of the project, because it did go on so long for Release 1, we did have some changes, some new tax types that were introduced that we had to fit into our schedule and bring into Release 1. Then there was a question about the DORIS and EMARS interface. The communication as far as the actual interface between EMARS and DORIS has been stable since day one. We did identify early on a couple of general ledger accounts that were misclassified in either restricted funds that should be general. Those were quickly remedied, the corrections made, but our actual connection has been stable since day one. All of the transactions reconcile daily with EMARS, and any exceptions are corrected within the same business day or prior to month end. And then the last question that we had was about our implementation schedule. So I'll touch on that just briefly. Obviously, we went live with Release 1 in March. And right now we are working on design, development, and testing for Release 2A. Release 2A is planned to go live in late summer of 2026. And it includes healthcare provider tax, insurance premium tax, electronic vehicle charging, ride share, and sports wagering tax, and supporting interfaces for those tax types. Release 2B is fall of 2027, and that is going to include individual income tax, pass-through entity tax, inheritance, and fiduciary tax. Release 2C is a minor small release, which will include compliance processes for all of those R2 Release 2 tax types. And then Release 3 will include all the rest of the tax types, which are a lot, and then also our collections process. So with that, I look forward to any questions that anyone may have.
Very good. Thank you. And how long has DORIS project been going on? It's massive.
It is, yes. So we started initial requirements gathering in December of 2019. And then I don't know if y'all remember, but we had a pandemic in March of 2020. And so we had to pivot to completely remote and work at that point in time. So.
Yeah. And when do you think ultimately it'll be finished and up and running, waiting for updates? Ballpark when?
Right. We've signed a contract recently that runs through 2031. So, and keep in mind that Release 3 includes about 70 tax types because it's everything that's not covered in Release 1 or Release 2. So it will likely be broken into small pieces. Mm-hmm. So it won't be a massive release at the end of that time frame.
And I think you've addressed both these, but I do want to bring some focus to it. The only two things I've heard that caused any concern and people were like, is the timing of the change over in February or March.
Yes.
And that may be for many reasons. So just as you're moving forward, I know y'all were, but that's what I heard more than anything else about the timing of that. And then the second thing you've addressed, I don't want to get into too much detail over it, but EMARs and that communication is one, but what's been related to me is reconciliation, and hopefully that's making good progress.
It is, yes. We initially, the first 2 months were a little delayed with reconciliation just with a new system. But since then, we've been reconciling and closing books within 3 days of the month end. So I look at that as great progress.
Very good. All right. Anyone? Senator Boswell.
Thank you, Mr. Chairman. Well, you are Department of Revenue, so I'm going to continue probably to ask this question. As a member of Appropriations and Revenue, I'm very concerned about this. So you may not have a direct answer, and I mentioned it before. So right now, today, I believe that I could go out and I could find 5 contractors or 5 restaurants that have non-citizen employees that are not paying taxes to the state of Kentucky. This is keeping us from gaining millions of dollars in tax revenue for our state and local residents. And can you mentioned audits several times.
Yes.
Can somebody, the Department of Revenue, somebody, give me a reason why we are not collecting and auditing these people to find out why we're not getting our taxes?
So obviously I will take that question back to my leadership, but we do have a special investigations division within the Department of Revenue that is tasked with investigating tips like that. And so any of those that do come in, they are charged with investigating those issues and auditing those. But I will need to ask about specific programs that may look at situations like that.
I'm not talking about restaurant employees as far as tips. I'm talking
Yes.
about employing people, paying weekly wages to them that are not being paid into the state of Kentucky cash or for whatever reason, consider them contractors, whatever. This is a serious problem going on in the state, and we are losing a lot of revenue.
Senator Dunn.
Thank you, Mr. Chair. Please hear this question as truly a question. In my professional career, I've implemented 2 systems with my department. I understand what you went through, and I also did one during COVID remotely, so I get it. I understand the challenges. My wife and I own a small business, so we're users of that system. Okay. Her experience hasn't been as pleasant as maybe some people's has, and she's had maybe just bad luck, but a lot of downtime. Okay. When do you schedule planned maintenance?
Planned maintenance is every other Thursday from 7 to 9 p.m.
Okay, so, follow up, Mr. Chair. So small business people wear a lot of hats, and they often do things from 7 to 9 on Thursday night. Is there any way you can look at peak times, peak user times, and maybe pick a time that would be better for the users to do planned maintenance? Is that something you can look at?
We can absolutely investigate that. You know, if you've implemented a system, you
understand, yes,
understand that we balance vendor availability along with our own staff availability to support and test before we release that to the public. But I will definitely take that back and take a look at it as a suggestion.
Thank you. I really appreciate that. Our small business owners carry the brunt of the work in this Commonwealth, so it's very important we're sensitive to their challenges. So I appreciate you doing that.
Absolutely. And if your wife has more issues, please tell her to contact me, and I will be happy to help.
Very good. Thank you very much. Thank you for the presentation. Update on a system that is so vital, so massive, and there's not a lot of people that know about it, to be honest with you, or about the big changes they're going to get. One.
No, I'm sorry. No. Afterwards.
Don't wave over here if you don't want to ask.
I know. No, afterwards. Thank you.
Thank you very much.
Thank you.
Next up on the agenda, we have number 6 and number 7. I would highly encourage you to look at the correspondence and the reports. Great information that the executive branch is supplying us with. And then, just so y'all are all clear, number 8, we're adjourned. Thank you.